Hello, welcome everyone. My name is Remy. I'm co-founder and CEO of Shen AI. Today we have Kaya with us from our team that she will be managing chat. So the Q&A session will take place at the end of the webinar, while you may answering the questions all of the time when we go with the material. So today with me is Przemek Jaworski.
Hello. I'm Shen Jaworski. I'm the CTO of Shen AI, and I'm responsible for technology and for the strategic development of future directions of where this technology goes.
So Shen is the Estonian company operating on the global digital market. And we envision a future where every individual can monitor his or her vital signs effortlessly using any device, either this is a smartphone, computer, or smart mirror in the future, making complete health checks as simple as daily routine. So since 2020, over 4 years now, we are working on scalable AI-powered technology that provides over 30 health markers, including key vital signs like blood pressure or heart rate. So let's get to the topic. And today we will be discussing and showing differences between traditional health monitoring made with traditional devices and the one that can be done entirely in a digital way. So starting from the current states, like traditional devices doesn't scale. The whole thing depends on the physical devices that come at a high cost with a very complex operational management. The data that is coming from them, if at all, is fragmented. Also, those devices are not always convenient to use by our users, which cause very low patient engagement, which then cause the data that is fragmented, and very often with not enough data provided, the reimbursement cannot be done. Finally, the scalability is very limited because each of person that is under the remote patient monitoring program needs to receive the full package of physical devices, and foremost, this is only like a one let's say aspect of how health monitoring should be done, which is only the remote health monitoring. There will be more use cases and more benefits that we will be talking at the end of the webinar. And before we get there, we first want to compare this traditional approach that is very costly. That the set of such devices is as much as $100 per month. Yeah, so this is the kit that consists devices, and on the top of that there is this operational complexity, sending those devices back and forth versus screening a number of vital signs, which technology such as Shen AI can cost only $5 per patient per month, which is like 20 times less than traditional approach. So the Shen AI as vital signs technology of vital signs scanning can make those health checks only under 1 minute using any camera. So the technology can be integrated in a smartphone. This can be also be integrated into a web service. So it's very accessible. Because of that, patients are not having any problems to access this kind of checks, and this leads to higher engagement. Yeah, so currently with the face scan, we can provide metrics such blood pressure, heart rate, respiratory rates, among others, and there's no additional devices needed for such. Yeah, and because of this technology can work with actually with any everyday technology, it can be used anytime and anywhere. Yeah, so the engagement is much higher because it's easier to use such technology, and because of that, the data is complete. The readings are coming into EHRs, and the reimbursement can be done.
Remy, can I add a little bit? I think what really matters here is that also when we have these physical devices, even if they provide like Bluetooth connectivity or some Wi-Fi connectivity, or even some people will mention wearables, most definitely. We have to say that if there is a solution, if there's a client that wants to use this end user data, then the integration cost of so many various manufacturers of these devices is really immense. And I think what really matters with Shen AI is this is a unified platform for providing health related data, and there's only like one and very simple integration. So like, let's imagine instead we would like to integrate with all the like smartwatches on the market. That's like immense burden, right? And in here, instead of that, we provide just like one thing that scales easily.
Yeah. So before we get any further, let's present a demo how the technology works in the real time. So let me share my screen. So this is the web integration of our technology being available at checkbp.com. So now I will start the measurement.
Okay, I'm going to comment on that because it's better if Remy actually stays silent. Actually, talking and too much movement is not desired in such situation. Although our technology stabilizes the face, it's still we want to make as much as we can to actually provide the best quality of the signal. So what you can see is the signal at the bottom is actually reflecting the activity of the heart. And we can see the pulse and blood pressure is being measured right now. Underneath this, there is actually many more markers being measured, and we're gonna go to these markers in a second. But as you can see, we can also see the real-time visualization of the blood flow. So the highlights that you see is actually reflecting the real flow. It's not the it's not just some gimmick. And here we go. All right, so we have blood pressure and pulse ready, and there is more underneath, as I said. So
yeah. So when we go further, there is like a longer list of health markers with the explanation of such markers, with the also a notification if any of these markers are above or below the norm. And also important to say that once this measurement is done, then the results taken and actually compute entirely on my computer right now. Those results can be seamlessly integrated with any data flows with FHIR API. We are also providing with the technology, so those results can be very easily manageable for the future or the further analysis.
A little note at the end here. just so that we go back to this issue of integration, right? Like if we talk about integrating it into mobile devices, this is still like there's some work needs to be done. But what you have seen just before, this was a web version. The web version actually is the easiest scenario, and actually the page you've seen is like a template that can be prepared for every client. So there is actually no effort with the integration. It's just a thing that just can be spawned, and it just exists on the internet for the users to use.
All right, so let's move forward, and there is like a number of customers that we are already serving to in 33 countries. And one of such successful stories with Dr. Digital out of Czech Republic. That actually Andre did exactly what we are discussing today. Yeah, so they replaced the necessity of managing the health monitoring with traditional devices, with a fully digital approach provided by Shen AI and accessible from within their mobile app as a complete set of the health services. So today, moving forward, Shen AI, as we presented, provides 30 health markers. Okay, if we can jump to the next slide, thank you. So among others, there is like a section with key vital signs, including blood pressure, heart rate, HRV, breathing rates. And also in the following screens in the flow I was presenting, there's also like a more health indices and health risks that are calculated based on the readings from the camera and based on the user input taken by the SDK itself. And altogether, not only for remote patient monitoring, but also for other use cases, this is like a quite complete set of health information that is expanding. So soon there is like a new markers that we will be launching. That is SpO2 and very importantly HbA1c, which is like a glycated hemoglobin that's like a will support also the diabetes as well additional risks. And so that's the plans for this year. And then I guess many of you can be interested like what's underneath. Yeah, so for as long as the user interface, we want to be as easy to use as possible. Do not be full. Like underneath is like a really complex technology that we would like to get to know much more. So Prem, can you share a bit of the secret sauce?
I thought we just gonna go to the next slide and then so the secret sauce. Let's wait 2 more slides for the secret sauce. So but it's coming. First of all, I like to add that this is not a toy. So we work with scientists. We work with specialists in like machine learning and engineering and computer vision. So the numbers that you can see here reflect the accuracy of the markers that we have tested internally, and we have published a report and numerous documents. You can download the report. Actually, Kaya will send you a link for that. We're running another clinical trial next month. So the accuracy is our main focus here. So you know that you're getting a solution that can be used in reality and provide some actionable insights and data. But today I would like to expand a little bit more on what the technology is and how it works and why we're actually introducing some new and fresh approach to this. Well, that's why we call it next gen. health monitoring, remote health monitoring. And there are a few key points. And let me start with the data. So every solution of such kind as ours has to be validated and has to be tested on various data sets. It needs to be also trained. There are several neural networks inside that actually power Shen AI. So in order to get this, we collected huge data sets, and like I'm talking like really like several millions of heartbeats collectively. Like actually there's few data sets like the first one that we mostly rely on is 70,000 people scanned with high resolution videos, and then that is backed by some biosignals collected by medical devices. And there is another data set that is like more like a low resolution signals, but it's like higher in number, and it's approaching 500,000 right now. That is collected from entire world. So the key here is diversity. Like we have like diversity in ethnic sense, various skin tones, and also various ranges of parameters, for example, like blood pressure. The other key point in this technology is, Remy mentioned that before, is real-time video processing that is actually happening on the device of the user. So there's no communication between the device and the server, like just apart from the licensing. So it's like a little ping, like it's asking for the license, but otherwise there is like no transfer of data. There is no transfer of biosignal, no information that regards to the individual that is scanning is transferred. And everything runs in real time. So I think this is a clear differentiator here. And then there's science behind it that, as I said, like we work with several universities and scientists and engineers. And because of the science, like we're introducing something new that I'm going to present today. And this is multimodal sensing engine. And it's about different look at what kind of information we can extract from a video camera. So Kaya, if you could just show this first video, please. And I'm going to explain. Yeah, so first, I'd like to show you the typical way we look at the information that is derived with remote photoplethysmography. And Kaya, if you could re-loop it, please, then it's going to keep running. So remote photoplethysmography is the way to utilize a video camera with red, green, and blue colors, and which are different wavelengths, to extract the slight changes of color in skin to see the blood volume that changes, and how it flows through the skin, because the skin is transparent. There's a lot of computer vision involved in here, and like hardcore engineering to make it happen. And we know that gives us a lot of information. That gives us the information about the timing of heartbeats, about the morphology of the wave, the amplitudes, and the time shifts, and so on. But then there is a limit. Like you can keep pushing with this technology, and then you hit a limit. And this limit only allows to actually extract a certain amount of information. So then there is a second way of looking at the video. And now if we can jump to another one. It's actually the remote ballistocardiography. It's something that has nothing to do with the color changes in the skin. It's just about micro movements. So each time heart ejects blood, there is a micro movement happening in the face, and it has different pattern in every person. So what you can see here is like some way of visualizing this phenomenon. But the key point here is that we're observing the same thing, which is like a single heartbeat, beat by beat. But we look at it through the two different lenses. The first lens is remote photoplethysmography, the color changes, and the second lens is the micro movement. And there's like a completely different technique for extracting that. I would compare it to the situation where we say like it's like having two set of eyes to observe one thing. Then we see the depth, right? With one eye, you only see like one presentation. Yes, Remy, you
And
want to ask?
also maybe it's good to emphasize like in which like specific situations like these two pair of eyes can bring the biggest difference.
Oh yeah, very, very good point. And so imagine for the remote photoplethysmography, the limits are typically the amount of light that you can have to perform the scan. And sometimes with darker skin tones, the signal is a little bit harder to extract. With remote ballistocardiography, this is not the case. In RBCG, we can actually leverage this and extract this information even in more difficult situations. And what's more important is that for each one of those modalities, we also can assess the quality. So there are situations where one signal is much better quality than the other, and then it could actually swing to the other side, and then so we can dynamically keep choosing the best signal and continue the measurement. So this is something that's coming up very soon to Shen AI and in next releases. And I'd like to show you something extra after that. There is also another way of looking at blood flow that we see at the face. So we not only look at the single pulsations and their amplitudes and their wave morphology, there is also an information about the vasculature that is in the face, and we can track the speed, direction of blood flow that provides some additional cues on other physiological markers. Like the state of vasculature and its changes in time should provide additional information that helps to increase the accuracy of markers like blood pressure, heart rate variability, and others. So this is the advantage. Yeah.
So we can say so that all of this let's say modalities together like expands the environmental conditions being set, like the light or the movement or the skin tone color quite extensively, right? But because like those kind of conditions for RPPG alone very often are just too difficult to provide reliable, accurate measurement. Yeah, with this new generation, we are just announcing today. With this additional modalities, there is like a few of such assessments happening at the same time, and even if one is not good enough for any given reason, the other still gives the insights.
So the key here is robustness. So robustness, so it's robust to various unfavorable conditions, and then it brings more accurate results no matter what happens.
Still being operated on the edge, yeah, because this, even despite there is like a more tech in it, the tech still runs on the edge, which is not only convenient but also secure, and also a number of things connected with the data handling or processing is simply not applicable for such setting.
Yeah. Okay. So I think we can jump to the next slide. Yeah, that's all of them together. So it's like having multiple sets of eyes on the same thing that is happening, right? So it's the same thing, just captured in through, let's say, 3 different lenses. And additionally, there is information that is not present if you look at every single one of those, but it actually comes out when you look at them together. So this is another thing, and of course, everything relates to accuracy and to like being able to capture this in better depth. Yeah. So let's move on to the next slide.
All right. So we've been talking about what's the current state of health monitoring, but the real world applications of such monitoring, they are much broader that are possible today with a hardware setting. Yeah, so we are seeing and already propelling the applications in preventive health, in populational health, also in telehealth consultations. Yeah, so the before visit or during the visit, the same monitoring just being done once can happen and provide this valuable data for provider, as well as chronic conditions management, very often done with different set of either mobile apps or web services. Again, with the technology which is fully digital and available all the time with the patient or with the user with his phone or computer. This is again something we can attribute to, and then finally different settings of home and elderly care. But this is the let's say much broader landscape of applications we can support with this technology, but also there's like additional benefits that are not possible with let's say traditional approach, which is not only accessibility and convenience we have been talking about already, and the costs, which can be like 10 or 20 times lower, but also the engagement because of better experience and accessibility. This also improves. And finally, scalability, with traditional devices, each of the set needs to be sent to one person at a time. With digital approach, you can scale from 1 to 1 million in one day, and there's no limitations. Yeah, and the reach is much broader because this technology can be also available in the areas which were actually difficult to access. And finally, with complete health data, the outcomes from such monitoring, either this is the remote monitoring or chronic conditions management or single telehealth consultation, those will be improved with this health data available at hand. So this is like how the future will look like. This is the way we are heading to, and this all of this supports our mission, which is providing such technology that can be used by everyone everywhere and be so accessible as daily routine. That's all. So we are now opening the floor for any questions as well. We are inviting you to take your assessment with this QR code. You can just go to our demo site and you can try it yourself. Okay, so the question's coming.
Yeah, this is like a known problem with the proper distribution of the data. So we're tracking this, and normally the number of readings that we have in our database of 140. I can give you the right number right now out of my head, but this is resembling the percentage that is required by the ISO norm when testing that. So it's like I think up to 10% of this above 140, and the error is higher there. So the mean absolute error is higher. Well, I don't remember right now, which that was about, I think, 8 millimeters up to 10 of mean absolute error. But there's more. There will be more reports this year coming up, so we invite you to actually read that once it comes up. Yeah. Yeah, Nigel has a question about skin tones. So currently in our database, I mean, like as I said, we have two database, like one of high resolution videos. There's about 20%. That's about that's about 10,000 of videos that is collected in Africa and South Asia. So we have skin tones that range. So the in Fitzpatrick skin tones of 4 and 5. This is the majority of this. There's also some of Fitzpatrick's 6, and in the other database we actually cover entire globe. So you could say virtually there's like every ethnicity you can think of, and every country in there. Yeah, so this is diverse. Blinks, facial expressions, tics, and involuntary movements.
Very detailed questions, like very nice.
Yes, you're pushing it. So for stabilization of facial texture, we use a mask, and actually this mask is seen during the scan. When you run the scan, you can actually see the mask appearing, and there's like this visual effect at the very beginning. So actually, yeah, it resembles the mask. On the left, you could see the grid. So of course there's a tracking algorithm, and the blinking happens, but blinking is actually filtered out from this. The tics and involuntary movements, this doesn't actually matter because the mask is actually following the face in every frame. So from frame to frame, the mask actually follows the face very, very accurately. I mean, of course, if you intentionally shake your head a lot, then the mask will reset, and then the measurement will restart. Yeah, this is a very wide question. I don't know. Remy, you want to take that?
Well, it's tricky because I'm not sure like what scan like to what extent this is like better to what, yeah. But I can guess that perhaps it's about how the scan is like better with the next gen technology than it was before with RPPG alone. So as we have been talking, well, there is like a big improvement, and this, let's say, additional layer of other modality that runs at the same time. When the first fails, then the other will provide the measurement. So I'm not sure like how better to answer this question, as it's like a very very broad indeed. Maybe maybe if you can just rephrase this one more time or add more context, this would be helpful for us to just provide a proper answer.
Yeah, there's a very interesting question that's coming up, and this is actually not available right now in Shen AI, but we work with another company on something that does utilize the scanning of eyes and retinas and sclera in the eyes. So this is coming up. There's something special. I don't think I can actually reveal too much, but it is happening.
So there might be more generations in the future. This is not, even though this is the next, it doesn't mean this is the last.
Yeah.
Okay.
Remy, that's, I guess.
Yeah, I'm just reading. Yes, actually, like we are already having customers in 33 countries, including LATAM. And well, the most important here is the intended use case. Yeah, so for now, this use case is mainly connected to let's say, non-diagnostic, or also you can say non-medical. So this is more like a support decision tool for the professionals, or this is the self-awareness for a patient. So this technology can be useful even now without the SAMD approval. It's very important though that then this needs to be very precisely classified and described for both patients or users and the professionals if they are looking on these results.
Okay, I'm going to take that one. Well, the skin color does actually slightly influence the reading, and the reason for that is that what we're registering when the heart is pumping blood is we're registering the difference between the color of the blood and color of the skin, because as I said before, the skin is transparent. So the closer the skin is to the color of the of blood, then the harder it is to actually distinguish these two, and that affects the quality of the signal. So it does influence it, although there's like several things we can do about it, and that's what we're doing as well. I mean, last year we introduced the multitonal sensing engine, which is actually has been trained on a diverse set of skin tones. And now we're introducing the multimodality approach, which is actually using a different way to capture the heartbeat that has nothing to do with color changes, right? And I mean the remote ballistic cardiography. And the camera quality is like a different topic, because, well, we normally think about cameras as, for example, as a resolution, right? Here, resolution has actually not very much to do with the quality. The quality is about the lens and about the f parameter. So how much photons actually enter through the lens. But there is also, again, like multiple things we can do inside of our algorithms to actually improve that. But as I said before, the key to getting accurate measurement is looking at it in multimodal way.
Yes, precisely. Yes, thank you. This is the slide I was looking for. So the HBRC actually is something that we're already working on. So this is planned to be available in the technology by the end of the year. So similar to other like AI-based viral signs, this requires like a large data set which we collecting, while cholesterol risk is actually already up. The risks, these three risks are coming quite soon, I believe so, and this or next quarter. So this slide presents like what is the roadmap for the next 3 quarters in terms of features. There's like many additional things that we are building in that also will be available in this 3 next quarters. Yeah. So another question, I can take that. As we discussed, all the computations are happening in the real time on a user device. Yeah, so that the video are not going anywhere during or after the measurement. Opposite, there's not even like a video per se. There's no file that is even stored on the device. So there's like a feed coming from the camera and being assessed by the technology as because of this and also because of this vital signs are compute like without like an initial input of user of any kind. And this also means that everything is actually processed locally without this I'm not sure is the video still on. There was some problems, I guess, with the connection. But
there was something.
But anyway, the reports from the first clinical trial is available on our website on the research section. There is also the following clinical trial that is about to start, and this report will be available in July, while HbA1c is still under development, so there is no reports yet available.
Yeah, actually, we do have more reports on blood pressure. Some of them are not on the website. So, like, if you want to know more, let us know.
Yeah, and the patient results, well, they're available once the measurement is finished. As well, very soon there is functionality of PDF reports, so a patient can send this report once the assessment is done. And finally, providers, so our customers can manage these results in many different ways. Yeah.
Oh, that's an interesting question, and I've seen it before. It's an interesting question, but I think I probably can't reveal too much about how we differ from traditional RPPG extraction algorithms, because that's where the secret sauce is. So I've been talking about some of it, and you've seen some of the demo, and you can read about it on our website. It's just that, yeah, I think I shouldn't go too deep. So let's keep. All right, I think I get it now. I think I get what the intention of this question was. Like, how do we know which signal, for example, from two modalities was taken into account? Okay, so well, that is also, I could say, part of our secret sauce, but this is like a special way of, I would say, yeah, labeling the various streams of data, and then actually there is some logic inside of SDK, of our Shen AI SDK, that differentiates between these two in real time. So as they happen, as the measurement happens, it knows which signal is of better quality, and it actually handles these two streams and then combines them as they happen.
Yeah. Yes, that's the longer question version. Okay, is that everything? I guess so.
Seems, yeah. Okay.
All right. So it was great to have all of you on the webinar. The material will be available for download for those that were subscribed for today show. Again, please, like, if you can just maybe put the page with the QR code. I advise everyone just to take an advantage and check how the technology works on their own. Yeah, that would be everything. Thank you everyone for questions. Thank you, Prem, for fantastic explanations of what's inside. Thank you, Kaya, as well, for managing the chat and sending us the questions. Yeah, have a good day or evening or morning, wherever you are.
Yeah, and you should come for the next webinar. There will be more. It's coming up. There'll be more about multimodality. There will be more about the various use cases and the technology and business side of it as well.
Yeah, the lineup is going to be interesting in next 2 months. Thank you.
Yeah, thank you very much. Bye.